Hello and welcome to this video about calf injuries. You may find this useful if you've had a recent injury to your calf, and we will discuss some basic anatomy and then introduce some simple stretching techniques that you can do before you have any further treatment or advice from a physiotherapist or other clinician. This picture shows a model we will be using later. We have added onto it linear depiction of the calf muscle. The soleus muscle in orange attaches to the back of the shin bone and comes forward into the gastrocnemius muscle in red. Where the two muscles join, they form the Achilles tendon, which inserts into the heel. The gastrocnemius muscle starts at the bottom end of the thigh bone. As can be seen in the diagram, the gastrocnemius muscle travels across two joints, the ankle and the knee. This is important in mechanisms of injury and how calf injuries occur. We will discuss this later when we are talking about rehabilitation. This model demonstrates what we have just discussed. As the calf muscle contracts, the toe points downwards because the heel is pulled upwards. The foot is moved into plantar flexion. If the foot is fixed, such as being on a hard surface, as the calf muscle contracts, the heel will be pulled upwards because the foot cannot push downwards, and you will end up standing on tiptoes. This push-off mechanism is often a cause of injury of the calf muscle. This is related to the anatomy we discussed earlier with the calf crossing two joints. Standing on tiptoes, as we have already said, is a cause of injury. This shows the person standing on tiptoes with the line of the joints, the pull of the calf muscle, and the weight of the body going through the ankle pushing against the pull of the calf muscle. It is the effect of the weight pushing against the pull of the muscle, so as the muscle is trying to shorten, the body weight is trying to stretch it, that makes this liable to injury. It therefore makes sense to think that if your muscle length is shorter, it is more likely to get injured when you stretch it in an attempt to move. Therefore, it is very important that stretching is part of a rehabilitation protocol to ensure that the muscle gets back to its normal pre-injured length. These videos show that by straightening the knee is stretching the calf muscle, or by bending the ankle forward is also stretching the calf muscle, as demonstrated in the model and by seeing the elastic bands stretching as the ankle moves forward. We will now show some examples of muscle stretches that can be done to help achieve this. As we have discussed, the calf can be stretched by either straightening the knee or bending the ankle. We have demonstrated this in the model, and these can be managed doing simple stretches. Firstly, with the bent knee stretch, put the foot against the wall and bend your ankle towards the wall to stop when the muscle gets tight and painful, and hold it in this position for 20 seconds. The tightness should ease and you can push forward for a further 10 seconds and then relax. Rest and repeat. When you can do this easily, move your foot back by a centimetre and try to bring your knee to the wall again. Eventually you will not be able to reach the wall with your knee because your ankle will not be able to bend that far, and then you need to progress to the straight knee stretch. The model demonstrates the principles of the straight knee stretch, where straightening the knee out stretches the calf muscle whilst the foot is fixed. This is demonstrated in the video, where the injured leg is put at the back and you take a step forwards with your good leg. Push the heel backwards on your injured leg to get the foot flat on the ground and straighten the knee. at the same time leaning forward, bending at the ankle to further stretch the calf. As before, hold the stretch for 20 seconds and then push a bit further as the muscle tightness relaxes. Again, do not do this beyond pain, but allow to do it within the confines of your discomfort. In summary, the aim of the initial treatment is to restore the normal range of movement by stretching exercises. It's important that you only stretch within your range of comfort and not to stretch beyond discomfort into pain. You should progressively increase the load by increasing the depth of the stretch as your injury progresses. Further progress should be as advised by your clinician or therapist, or as your condition dictates as you are returning to normal function. I hope that this video has been of help, and I would be grateful if you could subscribe to my YouTube channel for further updates on injuries as and when these videos are posted. Many thanks.